All right, well, we're going to go ahead and get started. Welcome everyone to the Leon.County panel for mental health. My name is Stephanie. I'm the library services specialist at the main library downtown, and I'll be your moderator tonight. I am joined by Helena Reid, a 211 Big Ben counselor, Dr. Mark Reeves, Apalachee Center Director of Psychological Services, Kelli Mercer, the Capital Regional Behavioral Program Director, and Laura Ireland, Certified Recovery Peer Specialist with the Community Action Team at the Apalachee Center. I just want to welcome our panelists, and if you would, just kind of introduce yourselves, tell us a little bit about why you're here on this panel for mental health. And we could start with Kelli.
Good evening. Thank you so much for having me. I'm excited to be with you tonight. Again, I'm Kelli Mercer. I'm the Program Director for Behavioral Health at Capital Regional Medical Center. I've worked at the hospital for about 5.5 years and worked in mental health for almost 15 years. So really excited to be with you. Enjoy what I do. Love working at the hospital. I'm also a board member for NAMI Tallahassee. So again, thank you for having me.
Unless whoever wants to go next.
I'll go. My name is Helena Reid. I'm a hotline counselor at 211 Big Ben. I've been there for about 2.5 years, and I'm finishing up my MSW at FSU. And yeah, I really feel like I found my home at 211, and I love this work. So thanks for hosting this.
Here, Laura.
Hi, my name is Laura Ireland. I'm a certified recovery peer specialist, and I work with the kids on the community action team in Tallahassee at Apalachee. I've been working as a peer specialist for over 4 years now, and got my certification about 2 years ago. And so I never thought I'd like working with kids, but kids are great. And I really feel like I've made a difference. And I thought this panel would be a good idea. So thank you for having me.
We're happy to have you. And last but not least, Dr. Reeves.
Yeah, thanks, Stephanie, and everybody. It's a great panel of people here tonight. I'm Mark. I'm a licensed clinical psychologist, also at the Apalachee Center. Mostly provide counseling or therapy throughout the week, and then also train or supervise student counselors. A little bit about Apalachee Center: we have outpatient clinic, so counseling and medication for adults and kids. We have some special programs like the CAT team that Laura's on, and a similar team called the FACT team for adults with more kind of serious challenges. We also have a hospital unit, just like Kelli's hospital does. I know she'll talk about that, for adults and kids, and also a unit for people with drug and alcohol problems who need to kind of detoxify from those. We have some residential programs. We have outpatient clinics in all 8 counties around the area. We serve people with and without insurance. We have a pharmacy on site and a medical clinic. And we also have the mobile response team, which is similar to 211 in that it's a hotline, but they actually can go out into the community if they need to as well, like schools or parking lots or whatever, they can go out there. So those are some of our services.
Thank you. So I just wanted to let everyone know before I get started, I have some questions that I'll be asking the panelists, but we will have time at the end where we'll open up the floor for questions from our audience. So just keep that in mind as we go. And we can go ahead and get started. My first question is going to be for Helena. Could you walk us through what someone might expect when calling the 211 hotline? What are some resources in the community that you regularly refer callers to?
Sure. So for anyone that isn't familiar, 211, you can reach us just by dialing 211. We have information and referrals for social services as well as short-term counseling. So what that means when someone calls is they usually tell us what they need, whether that be like rent assistance, food pantries, utility assistance. Those are definitely some of our more common ones. They'll let us know what they need. We try to engage about the situation and check in with them emotionally. So some callers aren't interested, which is fine, but others really appreciate it. So that way they know if they're not ready, at least they know we're here 24/7 to talk with them and be a support system. But if they really are going through something, we can have that conversation right then and there. We're all trained to answer the National Suicide Prevention Lifeline. And again, we're open 24/7. So a lot of folks don't know, if they don't know where to start, they can always give us a call. Some of our common referrals, like I mentioned earlier, once we have their zip code, we can tell them places in their area that might be able to help them pay their rent, pay their utility bill. Food pantries, mental health resources are a big one. We also have some additional programs that we can get them connected to for veteran resources for kids 8 years old and younger. And yeah, mental health resources too. So that's about it in a nutshell. We try to offer follow-ups to check in with them in about a week or two to catch it on the back end. If they need anything further, we can follow up with them then.
Thank you. My next question is for Dr. Reeves. Could you tell us what is counseling? Now that we're all gathered here to talk about mental health. So first things first, if someone's having mental health struggles and they go into counseling, what is that? And then how would you recommend someone prepare for their first appointment with a counselor?
Right. Well, counseling or therapy, psychotherapy, is a private meeting. It could be just with one person, okay, a counselor with an individual going to talk about their life. There's also, marriage counseling or family counseling or therapy. There's group counseling. I know Kelli will talk about their awesome groups that they have out there, okay? And the common thing among all those are that the special thing is that everything that a person tells a counselor is kept private and confidential, with just a couple exceptions, which is if that the person coming to counseling is really wants to hurt themselves or someone else, the counselor will help them with that. Or all of us, technically everyone in Florida now is what we call a mandated reporter of child abuse or elder abuse. So if that comes up, that's an exception to kind of that confidentiality, but even that, we're going to handle sensitively about how to proceed. But yeah, counseling is, again, just a private meeting. And if you want to prepare for that, think about two things. One, what you want to tell, and then what you want to ask. Okay, just like if you're going to like a new doctor, like a new physician. So the counselor, you're probably going to tell them about your life. It could be areas of throughout your whole life from childhood to present. Any kind of treatment history you've had before, like counseling or otherwise, any medication you might have taken. And then probably the main things that are stressing you out, right at that moment. And then things to ask would be that particular counselor's approach, because there's a lot of different approaches to counseling and their training. And then you might also just ask them specifically, do you have experience with my particular issue, whether that's depression or anxiety or whatever. And also we'd just like to mention that there are different kinds of counseling and therapies, and some of them are proven by science and some are not. And so the general recommendation is you could just ask your counselor therapist, do you do a therapy that's backed up by science? And most of the therapies that are under the type of therapy called cognitive behavioral therapy. That just means you look at your thoughts and your actions. But there's almost a CBT for everything, okay? Within reason, be ready to open up about what's going on in your life, because that will help the counselor to help you. But you're in charge, in my opinion. You decide how much you want to share. And also, a lot of current events have been around ethnicity and race and gender. And so really a good counselor should be able to help everyone. Obviously, I'm a white male, if you hadn't noticed. And I work with people from all kinds of backgrounds. But if you're, say, a Black woman, you might want a Black woman therapist, because she's just going to get some things automatically about you that I'm just not going to get. Okay, so the cool thing is there are awesome therapists of all kinds of backgrounds in Tallahassee. So you may look for that, or like sexual orientation or gender status or even faith. There are some faith-based counselors, so you may consider that. And therapy, people don't always know what it's like. Okay, so part of it is talking about your issues, but sometimes a therapist is like a teacher also. So we may teach you skills like how to deal with stress, how to communicate, how to solve problems, and people really appreciate that. Let's see. And for me, therapy is all about the client and what they want. So you usually want to improve your relationships or your work functioning or a school, just growing in different areas, change some habits. So counseling is about that. And we'll probably talk a lot about stigma tonight. And so just remember, going to a counselor or a therapist doesn't mean that you're weird or weak or a bad person. And I just personally, my philosophy is I tell my clients that they're my boss, like every single one of them. So I would just like people to consider, your customer is always right, even in counseling. So, just to view it as, I often give the analogy like a personal trainer at a gym. I'm not like some kind of know-it-all that's going to tell you how to fix your life. I work for you. I actually have some expertise, but try and help you to kind of help yourself. And last point is, like counselors like me, I don't have any medical degree. I can't prescribe medication to you, but we might talk about, hey, I think what's going on with you might benefit from medication. So I might recommend that a client of mine talk to their doctor or a special kind of nurse or doctor about medication. But I also am very respectful that some people are not interested in that. So it's just a discussion that comes up.
Thank you, Dr. Reeves. That was a lot of good information. The next question is for Kelli. I know we talked a little bit about some services that are at Capital Regional Behavioral Health. I was wondering if you could actually tell us a little bit more about those. And then also, I know that you do work with the Jason Foundation. I was hoping you could tell us a bit about that and what their mission is.
Sure, be happy to. So I'll start with our programs at the hospital. We do offer an inpatient program, as Dr. Reeves mentioned, an inpatient adult behavioral health program located on the 7th floor of the hospital. We've been open almost 6 years. So we have a lovely inpatient unit. If you know someone that's struggling with a mental health crisis, you're welcome to bring them to the ER 24 hours a day, 7 days a week. We'll be happy to speak with them and try to get them some help. In terms of outpatient, we do some things a little different than what Dr. Reeves and his folks over at Apalachee Center offer. We offer what's called a partial hospitalization and intensive outpatient program. It's a group therapy-based program for individuals that don't necessarily need to be inpatient. They're not in an active crisis, for example, that perhaps need a little bit more help than an individual one-on-one counseling session. And so if you think of mental health as a staircase, I like to describe the top step as I'm in crisis, I need to be in the hospital, and the bottom step as I see a counselor once a week or once a month. And so this is that middle level of care. So perhaps the individual is transitioning from an inpatient setting, or they are taking a step up with the hopes of avoiding the hospital. And so it's a great program. We offer that service for adult mental health. We opened that program about 4 years ago. We have a substance abuse intensive outpatient program that's more geared towards addiction. We run that program Monday through Thursday, 4:30 to 7:30. We have a university specific intensive outpatient. We opened about 1.5 years ago. And it's actually a second location for us. It's located over near FSU, but it's open to any college student, FAMU, FSU, TCC, et cetera. It doesn't matter. The only requirement for that is that the individuals participating are involved in the university in some capacity, either online or maybe they're perhaps taking a semester off and trying to get back into the school system, but in general, they're college students. And then we opened an adolescent intensive outpatient program in April of last year, which for ages 13 to 17. So again, if you have a child, I think I saw a question in the chat that someone has a child struggling with depression, for example, and they maybe need a little bit more than individual counseling. This would be a great opportunity for that individual to get some help. Again, so a little bit more of an intensive approach than the individual counselor, but it's all group therapy based. The individuals participating in those programs do see a physician. And so that is part of the process. So they are offered opportunities for medication management. The initial assessment for all of our outpatient programs is free, actually. So if you're even remotely curious, I always encourage you to come in for that free initial assessment just to check it out, talk with us, talk to us about your concerns. And at the end of that time, if you think that you'd like to give it a shot, we can usually get you started pretty quickly. And if you don't feel like it's a good fit for you, there's no obligation. So it's just a really wonderful opportunity. We're the only intensive outpatient program here in the Tallahassee area, and we help a lot of individuals. So it's a very busy program, but it's got a great reputation in town. And then we also offer ECT services as well. So we can help you at all. Feel free to give us a call. You mentioned the Jason Foundation. So the Jason Foundation is a nonprofit out of Hendersonville, Tennessee. At Capital Regional, we are an HCA hospital, and through that partnership, HCA and the Jason Foundation, that actually gives me the opportunity to share information on the Jason Foundation, which is a focused on youth suicide prevention. Their target age range is 10 to 24. It was founded by a gentleman named Clark Flatt, who lost his son Jason to suicide at the age of 16. And so Clark said, as a parent, he was offered many opportunities for education, drugs and alcohol, et cetera, but never anything on suicide prevention. And so after he lost his son, he made it his mission to educate parents and families and teachers and youth about the risk and warning signs associated with youth suicide, in the hopes that he might be able to help that family member or teacher, et cetera, to save that young person's life.
Yeah, thank you. Thank you for that. So my next question is for Laura. Laura, I know you work as a recovery coach with Apalachee Center, and I was wondering if you could tell us a bit kind of about what that role entails.
So I always like to explain the role as a recovery coach as someone who's been there, done that. I know I have an idea of what you're going through, so I can connect on a different level than, say, a therapist can. And so I personally teach something called Wellness Recovery Action Plan, or WRAP, and it goes through their wellness tools, like their coping skills, identifying their triggers, and then like signs of a crisis, and then what you can do in each of those instances so that you can stop before you get to a crisis. And then we create a crisis plan at the end for if you do get there, what is that going to look like for all of the people that are involved in your life? But I do a lot of work with advocacy and mentoring. Those are the two biggest things that I do a lot. So I go to the schools. If there's a student having issues, I'm the first one at the school advocating for their mental health and their school stuff. And then I'm just kind of like I don't know, almost like a big sister, but in a professional way. Yeah.
Thank you. Thank you. So my next question is for Helena. What is the best way to respond? I know it's hard when someone approaches you, and especially if it's someone you're close to and they tell you that they're having a mental health crisis, or they are considering, just in a very bad place. So what do you do when someone reaches out to you and they are having a mental health crisis? I know that you might get like calls like that a lot at 211 Big Ben. So wondering if we could get your insight on that.
Yeah, that's a good question. So I think the biggest gift you can give someone is just to listen. So start off by taking some time to hear them out and validate their feelings. I was really surprised to learn that the definition of crisis is self-defined. So it's super important to keep that in mind and to meet them where they're at, not where you want them to be, not where you think they should be, but where they're really at. Most folks aren't looking for advice. They might be down the line, but someone in crisis really needs you to honor their experience first, not to rush them towards a solution. And our instinct to fix things, it's usually well-intentioned, but it's often because we're uncomfortable with their pain, and they're really looking for empathy in that moment, not solutions. So I think that's always a safe start, and it's surprisingly effective.
Yeah, thank you for that. And I gotta notice I have trouble with audio. Can everyone hear me okay? I just tried a different mic. Okay, sorry. Typical tech problems. Let me see, my next question, Dr. Reeves, what are some signs that you are dealing with a mental illness? Because I know that, everyone experiences normal anxiety and sadness, but how does someone know that it is something that's not just a typical anxiety or sadness, and maybe they should reach out for help?
Sure, yeah, and partly I want to build off what Helena said about crisis is self-defined. To some extent, I think this question is self-defined as well, because if it's sort of like upsetting enough to you, we're not going to turn you away as a counselor, okay, or as a treatment provider. At the same time, there's kind of two main parts of that, which kind of relates to that. One is just how much it upsets you or bothers you, whatever this thing is, this issue, okay? And then it's like kind of emotionally how distressing it is. And then the other one is how much does it get in the way of your life, of living your life, like your work or your relationships or your sleep, or your appetite, things like that, okay? So you mentioned sadness, and you would compare that to, say, like depression, like diagnosable depression. So right, we all feel sad sometimes. We may cry some, feel a little bit down for a little while, especially after like someone, a loved one or a loved pet passes or a stressful event. But it sort of passes, and you can still go about your day and function at work and in your roles. Okay. Depression, actually, people will use that term as a feeling. It is a feeling. I feel depressed, people will say, but clinically or diagnostically, it's a syndrome. There's a set of symptoms that hang together. So the crying, for instance, might be all day, every day, sort of nonstop for at least 2 weeks, okay, so or several weeks. Low energy, don't want to do anything, like no motivation, even things you used to really love to do. You just kind of withdraw from people. You don't want to talk to them. You don't even want to answer their texts. Your thoughts may get really dark and even suicidal thoughts, or like feeling very guilty or worthless, trouble concentrating, kind of like foggy thinking, trouble sleeping, like either sleeping a lot, like 12 hours or 16 hours, or just not being able to sleep at all. And then any one of those things may not necessarily, again, become a diagnosable mental illness, but when they're all together and that it's really consistent for kind of a long time, that's a more of a sign. Okay. And then there's many examples, but just with anxiety, we all get a little nervous at times. But then there's something people call, that's called a panic attack. Okay. And panic attack is really, really severe. And if you've ever had one or know someone that has had one, that's really, really upsetting. Okay. Or many people, unfortunately, go through traumatic events in their life. Okay. If they were assaulted or a car accident. We had Hurricane Michael right here locally a couple years back. COVID, traumatic. Okay, maybe it's not one particular event, but just this whole time. Okay, so people now are having flashbacks to Hurricane Michael, two and a half years later. People are having nightmares about that. Okay, you might about some kind of traumatic event. So that's more than just sort of a little nervousness. Social anxiety, you get really, really, really nervous in social situations. Generalized anxiety disorder, you just not just a little bit of a worrier, but really intense worry to the point it just interferes with your functioning. So those are some examples of kind of that line where people may become more concerned.
Thank you. And then my next question is for Kelli, and it kind of builds off of my question for Helena. Kind of conversely, if you, instead of them coming to you, if you notice someone like a loved one or someone that maybe even a coworker is having a mental health crisis, or even the worst, you suspect they're contemplating just doing something bad, what are some of the best ways to approach that person and provide support?
Absolutely. So the one thing I always tell people initially is just to remain calm. Even though you may feel kind of shocked or overwhelmed, it's definitely important to stay relaxed. If the individual is opening up to you, he or she must obviously feel comfortable with you, or in order to maybe express some of those deep concerns or thoughts that they're having. Particularly with a child, it's important to have someone with them and to be sure, don't leave them alone. And remember that, you are what that particular individual needs right there in that moment as a friend or a parent. And then just listening without judging and show that you care, ask them how they're doing and keep asking. And instead of saying, maybe what's wrong with you, say, why do you think you're feeling this way? So just kind of maybe perhaps think about how you phrase things. Particularly in terms of suicide, be prepared to talk about suicide with the Jason Foundation. And we like to point out that 4 out of 5 completed suicides gave warning signs before the attempt. So, be afraid to talk about it. Don't be afraid to ask. By discussing it, you are not putting the idea in their head or increasing the likelihood that they're going to attempt suicide or engage in suicidal behavior. An open discussion can help actually decrease some of the anxiety experienced by the suicidal young person or adult for that matter, and actually can come as a relief to them that someone else cares about them and wants to help them. And so, but also it can remember, don't minimize or dismiss their problems. I think it was Mark that perhaps said, it's all individual. As a crisis is all individualized, and what is a crisis for you may not be a crisis for them, and vice versa, right? So you don't want to minimize it or dismiss their problems, and try to instead you want to try to provide them with that reassurance. And then be sure to acknowledge their fear, their sadness, or their emotions. Tell them that you're here to help, and you want to help them. And then of course you want to be prepared to act, right? So if someone opens up to you with a mental health concern, you want to don't be afraid to get involved, take action, and get them help. Link them to 211, call 911. Call the Suicide Prevention Lifeline. I know Helena mentioned that 211 here locally actually answers a lifeline, suicide prevention lifeline call. So, absolutely offer to be there with them through that process. Take them to the nearest emergency room. And then, if you're in the means to safely do so, limit their access to any type of means that they may use to harm themselves, such as medications or firearms, et cetera. If again, it's safe, you're able to safely do so. And this is something I think a question I get a lot is, well, what if they ask me to promise not to say anything? And then so, one thing to think about is, you can't promise the confidentiality in that piece of it. Try if at all possible to avoid making that promise, and be prepared to break it if you do, because, keeping a promise in that nature is not as important as saving someone's life. And so I think that's something that we often, we're so afraid that we're going to upset someone or make them mad or what have you. But again, is that really as important as saving a life? So the Jason Foundation offers a wonderful resource for parents, teachers, and youth. If you check out their website, jasonfoundation.com, there are a ton of videos and just facts and do's and don'ts and things like that are just absolutely phenomenal in terms of learning all about suicide prevention, warning signs, risk factors, what to do, what not to do. They've actually got a free app you can download as well, that again you can keep right on your phone and gives you warning signs, risk factors, things like that. So if you can't remember them, then certainly a good resource to go back and take a look.
Thank you, Kelly. So my next question is for Laura. We kind of talked about what to do if we notice that someone's like having a crisis, or how to tell if your distress is above a level where you feel like you need to go to a counselor. I guess our next question is kind of, what does recovery from a mental illness look like?
So one of the biggest things, for me anyway, is that you don't get fixed. There's no fixing mental illness. There are some people that will have it for the rest of their lives. However, recovery is acknowledging that and then learning ways to cope with it in daily life so you don't end up in a crisis, so that you can function in society, every day. And so that's taking your meds, knowing your coping skills, knowing your triggers, how to handle them when you do experience them. And just always remember that there's nothing wrong with you, and there's no fixing because there's nothing wrong. You can't fix something that's not broken because you're not broken. So that's the biggest thing, is that it might be there for life, but you know how to cope with it and you know how to handle it.
for that. I think you're absolutely right. My next question is going to be just for the group. If someone is physically ill and calling into work or school, there's no question about them doing so. It's seen as normal. But if you call in and say, hey, I need to take a mental health day, there's a stigma attached to that. Kind of wondering why is there a stigma, and what can we do, especially within our workplaces and school systems, to change those mentalities?
I don't want to speak for everyone, but we serve the entire Big Bend, and we generally run into this issue more in the rural counties where it's just really small areas and everyone seems to know each other, even for their entire lives. So a lot of the issue is feeling the shame that someone is going to know, and that it's not normal. It's something that no one should know. You should keep it to yourself. Often families prefer to keep that within the family. So I hope that whenever they do reach out, the folks that they get to talk to normalize that experience and let them know that they're far from alone. There's tons of resources to help. Even recently, just telling someone that there are resources that exist to help was kind of shocking, because they felt like they were the only one that was going through those difficult feelings. So.
Yeah, I think some of it is self-imposed too, right? I mean, in America, we're tough. You know, you go to work when you're sick, and sometimes, you know, people say, well, oh, I'm sad, my spouse died, or my pet died, or, you know, I'm homeless. Whatever, just, you know, I can handle it. Okay. And so, but we want to say it's a big deal, you know, and you know, sometimes suicide relates to work stress, and sometimes the people dying by suicide are physicians and dentists and lawyers and teachers, because they don't take care of themselves, right? And on this panel, I love your brochure, by the way, for this event. It's incredible. Okay. A huge thing that we've been talking about during COVID is just a simple 2 words: self-care. Okay, and I love 2-on-1's Facebook page too. You all have just really great little memes that are about so many different kinds of self-care. And I think an important self-care is if you really need to stay home because you're having a mental health crisis, or you just really need that time to take care of your heart and your mental wellness, you know, maybe that's just all of us recognizing that that's just as important as physical health, and it's just all health.
So Monty's, I absolutely agree with Dr. Reeves and with Helena. My other you know, add on to that would be just to openly talk about it. You know, I think just keeping the conversation going and letting people know that, yes, I experience those issues too sometimes, and this is what helps me to get through it. So I think just keeping the conversation going, just having events like this or other live presentations when we can do those again, and just engaging with the conversations with your friends and coworkers. Again, as Mark mentioned, during COVID, of course, we're all stuck at home, or, you know, we're not, we're distancing from each other. And so I think keeping in contact via text message, phone calls, Zoom calls, things like that are really important. Check in with those that you care about. Maybe people you used to see all the time and now you don't see them or haven't seen them in a year. It's hard to believe it's been a year. And there are definitely people I have not seen, colleagues I haven't seen in a year. And it's incredible to think it's been that long already. And so I think that's the important part, is to keep in contact with friends and family and keep the conversation going, that, you know, mental health is something that we all experience on some level at some point in our lives. And to hopefully, by all of us engaging those behaviors, we will hopefully help to normalize it.
I would say that added education within the workplace and then like out in the community in general to normalize it, because I feel like a lot of people think, well, I can't see it because it's in your head, so it can't be real because it's just you experiencing it. I'd been through the same thing and I didn't have the same problem. And so education on what it looks like, and then normalizing it to the point where, yeah, if you don't feel like you can get up out of bed because you're depressed, then you take a day to just relax and do self-care and stuff like that, just as if you were running a small fever. So education and then just talking about it and normalizing it.
Thank you, everyone. So my next question would be technology. It's kind of transitioning into kind of COVID-19's effect on our mental health. And a part of that has been technology has been vital during this time, but it also can be harmful. So considering how connected everyone is now with cell phones and tablets, Skype and FaceTime, why do you think there are still so many people struggling with loneliness, isolation, and lack of support? How do we strike a good balance between using those devices for good while also acknowledging the detriment it can be to our mental health?
The first thing that comes to mind for me is we've had a lot of lifeline calls that are from seniors, which is not our typical population. And I think one of the main issues that might be present there is that they don't have technology like the younger generations do, where they stay in constant contact, which can also be harmful. But they're already isolated now with COVID. It's extremely isolating. And if you can't send a quick text or an email, it can feel like you literally are all alone, and they only know how to pick up the phone and call, strangers now. So that's so hard. I guess that's just the other side of the coin that you mentioned, but obviously having too much can be bad too.
One thing I've seen people talk about is, this again, there's wonderful parts and stressful parts about technology. So the wonderful part is we can do this event, from our homes, our offices, and connect with each other. And I can be in touch with my cousin in Norway, and my parents in Michigan and stuff, really easily, video in different ways. Actually, I think my mom is on this right now. Hey, Mom. But also, you can't replace that physical touch, right? I mean, it's just heartbreaking that people can't hug each other, or even, like you see your friend and you're like, hey, but we can't shake hands, so there's that need for that in-person contact and human touch. And hopefully I got my first shot, yay, last Saturday, and hopefully more of us can get shots and keep masking and washing our hands and all that good stuff, and maybe we'll get back to that. But yeah, there's some things you just can't replace. So just hug on your people in your bubble and your pets, and connect as much as you can. Get outside, get some fresh air. Sometimes put your phone down. And some people are deleting their social media apps because they're stressful and they're kind of addictive. And just like turn to your family, right? People are talking about this is a really stressful time, and yet a lot of us are having way more time with our families, and this is going to go away at some point. The bad stuff's going to go away, but the good stuff's going to go away. So maybe just take advantage of this extra time we have to be close and, love your family and people in your bubble.
So just to add on to what Helena and Dr. Reeves mentioned, I think that, there obviously are pros and cons to social media and technology. And again, things like this are wonderful. We're able to get together and have a great conversation. But obviously, as Dr. Reeves mentioned, social media can be addictive. It can be a bad thing. And so I always tell people to find ways to obviously interact outside of social media, outside of their phones. Put your phone down for a little while, engage in a conversation with your family. In my home, we leave our phones in another room during meals. So really making sure we have that time to have a conversation with one another versus staring at our phone every 5 minutes, right? And so I would just encourage opportunities for that. Put phones in a box and put them in another room for a little while and really engage in that family or friend time without using your smartphones or devices. And so another thing I'll mention too is I feel like a lot of young people use social media to find ways to validate themselves or make themselves feel good or to build their self-esteem. And so, how many likes can I get on, Instagram, Facebook, what have you? And so, trying to help young people and adults for that matter as well, find ways to build their self-esteem, to find validation without having to go through social media. Those of us that grew up without it and adapted to it as it became part of our lives. Sometimes it's easy to forget how we did it in the old days without social media. And so maybe helping a young person who's always known social media, he's always known Instagram, he's always known Facebook, doesn't know what it's like to not have it, to explore ways to find comfort and validation and to build their self-esteem without those devices, because obviously it's possible. And as Mark mentioned, it definitely can be a negative thing as well. And I think we spend so much time focused on those things now versus what's really important. And again, if you don't get, as many likes as you thought you would, et cetera, then it can obviously damage your self-esteem. So I think just kind of grounding people and helping them realize that there is life outside of that smartphone is super important.
So to kind of build on that, we noticed when COVID hit that a lot of the kids that we work with started to, like, they weren't participating in therapy as much as they were when we were seeing them in person, and they started to decline pretty significantly with their mental health when the world was shut off. And we found that it's gotten a little bit better now that like schools are back in and stuff like that, but that's because kids are going to school. Those that are going, they're interacting with their friends at school. They're not on their phones all day. But then the kids that are stuck at home due to like sometimes like medical reasons and stuff like that, they're still having that issue with isolation. And if you don't have, like, when you're standing in front of someone and you're talking to them, it's almost an immediate response, right? They're validating what you're saying as you're saying it. When you're texting someone, what if they have to go to dinner and they can't text back? So you can be in a crisis, you can be having a situation, and that person's not texting you back. So you have that lack of support and you're just alone. And so while it can be a good thing because it can help you find friends, if you're not in person with someone, you're going to get that to the point where you're going to start to feel lonely. So I'm glad that we're starting to open things back up again. And I think as we continue to open things back up and after school activities start, or persons like visiting and stuff like that with the elderly, I think we're going to see a decrease in those issues. But we all have to do what we have to do with the masks and the washing our hands and stuff to get to that point.
Yeah, thank you, everyone. So I am going to ask one last question, and then after that, I just wanted to let everyone know I'm going to open up the floor for questions. I've seen that the panelists have been answering questions as they've come in. Thank you guys for that. But if you have any question you've been saving, you can either type it into the chat. If you change where it says to, you can change it to all panelists. If you don't want your question to be published to everyone and we'll read it out, we won't mention your name. Or you can put it in, if you click the Q&A option, you can enter it in that way. So just kind of keep that in mind. And then I'll ask my last question here. It's kind of a general question. Are there any other resources each of you would recommend that have not been previously discussed in the panel? Any tips, anything else that you would want to recommend?
So one of the resources, I want to give a shout out to NAMI Tallahassee. I see a few folks on the attendees list there from NAMI. We have a lot of wonderful free resources. We offer free classes, peer support groups, family support groups, etc. We engage in presentations like this on mental health and trying to reduce the stigma. So please, if you haven't checked out NAMI Tallahassee, that's NAMI, National Alliance on Mental Illness, please definitely give them a chance. They've got a wonderful opportunities and resources. And I think I saw some of the comments mentioned looking for volunteer opportunities. We always accept volunteers with NAMI. So definitely check out NAMI Tallahassee.
I think everything's been very well covered, but just real quick for more specific things, through 211, we have a veteran care coordinator who's also trained for peer specialists, including answering the suicide lifeline. I know there's veterans out there that have a harder time reaching out, so it's nice to talk to someone who's been through that. We also have a mental health navigator program through 211. So if someone calls and is looking for mental health resources, we have a staff member whose job it is to follow up with that person until they get what they need, help them figure out, who takes their insurance, when are they open, do they have telehealth options, just so they have someone in their corner, because it is super confusing even under the best of circumstances. So yeah, if you need something more specific, there are more follow-ups that are available through 211 as well.
An organization also that's kind of over several organizations called the Mental Health Council of the Big Bend. If you kind of Google that, Kelli and I are on that. 211's part of that. So we're kind of, most of us are part of that. And it's just kind of a Avengers or Justice League, if you want to call it locally, of mental health resources. And so we connect to that database with 211, and we have some resources on there. I'll just mention a couple interesting things. There are different kinds of therapies in counseling as well. FSU is actually world renowned for an art therapy program. So if you've never heard of art therapy, it's incredible and fabulous. Just doing art yourself is great, but then there's more to it with art therapy. Music, we also have, FSU has a world-renowned music program, but did you know they have a world-renowned music therapy program also? And we have music therapists throughout the community as well. This is going outside of mental health, sort of, but there's other ways of self-care, like spiritual coping, if that's part of your life. Again, being outdoors, getting fresh air, developing hobbies, or building new hobbies. There's a million trillion self-help books out there. And now there's a lot of apps that are include CBT, DBT, all kinds of things like that. There's a Google number of Google videos and YouTube videos about mental health topics, and probably all kinds of personal stories, right, of recovery. And then possibly the biggest resources is all of us, right? So I can't tell you, a couple people have mentioned it, just check on people, check on whoever, your neighbor, your friend, your family members. People are turning to substance use a lot, alcohol and drug use during this time. There may be increased incidents of child abuse or neglect or domestic violence. So check on the people in your life and maybe discreetly ask them, or get a sense if any of that is going on. And like a lot of people said too, people may not be aware of their own mental health issues. So if you can kind of learn a little bit about yourself and you have a suspicion that a family member or neighbor or friend is experiencing an issue, you might educate yourself a little bit on that and ask them, and then, listen, like everyone said, encourage them to get whatever kind of help or take care of themselves.
I wanted to just briefly talk about the CAT team, because I think it's a great resource, not just because I work here, but because in general it is. It's a intense program for kids between the ages of 11 and 21. And they have to fit certain criteria like hospitalizations, problems in schools, DJJ, DCF, involvement. And we offer wraparound services. So we have everything that we do is in-house. We have a psychiatric nurse that does our meds. We have a nurse that helps with all the meds and medical questions and stuff like that. We've got 2 recovery coaches, at least on the Leon team. One is me, that I work with the kids, and we have one that works with the parents, and we have therapists and case managers, and then our supervisor. And so we include absolutely everyone that's involved. If you've got a DCF worker, your DCF worker is at our monthly meetings. We involve the school in everything that we do. And so it's kind of like the last step, I guess you could say, before any kind of residential, that we definitely don't refer people to residential if we don't absolutely need to. So that we service, there is 3 different CAT teams. My CAT team services Leon, Gadsden, and Wacola, and then we've got one for Madison, Jefferson, and Taylor, and then one for Liberty and Franklin County. So we service the entire Big Bend. So if you have any kids, if anyone knows anyone that needs those kinds of services and fall within those criteria, then you can contact Apalachee Center and we can help you guys out with a referral. And then I also wanted to mention that WRAP, the Wellness Recovery Action Plan that I talked about a little bit earlier, they do have an app on your phone, which I think is really cool. I have all my kids download it. And then they also have a website that you can go to for all the resources if you want any help with learning more about your triggers and your coping skills and stuff. and it's through the Copeland Center. I'll find the web address and I'll put it in the chat.
Yeah, thank you, everyone. Thank you for answering all of our questions and for being here with us tonight. There's been a few questions that have come up that you guys have been really quick and great about answering as they've come up, but just gonna go through here. First one is, my child struggles with depression. What options are out there other than individual counseling?
So I'll answer that one. I kind of hinted at this earlier, but we do offer an adolescent intensive outpatient program for ages 13 to 17 at Capital Regional Medical Center. Again, it's a group therapy-based program for individuals that don't meet inpatient criteria. Again, they're not in active crisis, but they definitely could benefit from a little bit more than an individual counseling session can provide for them, once a week or once a month. And so it's a wonderful resource. We're the only one here in the area that, to my knowledge, and we offer a free initial assessment for the program. The individuals attending the program do have access to a physician. Group therapy, they learn coping skills, they learn how they are able to identify with other individuals in the group that may be experiencing some of the same issues. And so it's just a great resource. We've opened almost a year ago. It's hard to believe. And if you're interested, I'll put a link to our services and the phone number in the chat section.
Yeah, and then this has been stated, but medication, right? So in addition to counseling, even if you're sticking with individual counseling or not quite to the step of IOP or CAT, and then a higher step, actually, if it really is a serious crisis, hospitalization, right? So, and if people don't know, when you're hospitalized with a mental health condition, even a teenager, it may only be like a couple of days or a few days, and the child will see counselors and nurses, social workers, and a prescriber. Often medication is suggested, but it's never forced. So those are maybe some additional resources.
Thank you. Next question is, let's see, what helps with anxiety in the elderly during these uncertain times? Like we've kind of touched upon how, especially since they're not as technologically, some of them struggle with technology, they're not as connected. What are some resources for them?
I think I answered this somewhere in the chat or started to, but I always think it's a good idea to acknowledge that anxiety and validate it, because that makes total sense to be feeling that way, especially when you're less connected than a lot of the world. It can be helpful, like just to have a routine, to find things that, bring joy. And if you can find people that are feeling the same way, because I know there are probably a lot of folks that do. It might be harder to connect with them, but I know hospice is a good general resource, elder care, the senior center. There's a lot of very wonderful people out there that would love to help folks feel less alone, if they're willing to reach out and get those resources. But a lot of it does start with you. Like, what do you like to do? What would make you happy where you are now? And that's sometimes a harder question to answer.
Right, and Nancy from NAMI is jumping in on the chat here. Like Helena mentioned, the senior center has a lot of just awesome like classes and all kinds of things. But like Nancy's mentioning, Melanie Lockman has this incredible award-winning program called Upslide that even before COVID is just awesome in reaching out to seniors, but they're still doing a lot, during COVID. So just senior centers, awesome all around.
Thank you, everyone. I'm trying to pick out which questions I haven't seen you guys answer. Have any of you seen anything come up that hasn't been addressed?
There was a question about telehealth, and there's a lot of telehealth options, and a lot of insurance companies are covering that. I've been working from home actually for the last year, and all of my work has been telehealth. So I'm a counselor, and I can tell you for sure we're doing that still at Apalachee Center, but a lot of other services are also telehealth. So if you just ask your insurance company or 211, just 211, just 211 for everything. Start there, people. They're awesome. Okay, but everything else as well. But there's definitely a lot of telehealth options out there.
Do they have telehealth available for those? What if you didn't have insurance? Do they have programs available that you could meet with a counselor?
We do, right? So I have some clients and my interns and other therapists at Apalachee Center service people with without insurance, and I'm pretty sure, I don't know if Helena, you know off the top of your head, but I want to say neighborhood services, I might be out of date, but there are, okay, we're getting a thumbs up from Helena. Okay. I know there's just different programs in town. Also, it's not exactly the same as counseling, but again, 211. I'll just keep saying 211, 211. Okay, talking to, yay, thumbs up. 211. Okay, and then yeah, Nancy's reminding me the FSC Behavioral Health Center at the Apalachee Center over near TMH accepts uninsured clients as well. But talking to a 211 counselor can save a life, and it can help get you through a stressful time. The mobile response team that we have, there's no charge for that. Kelli mentioned that at least the initial appointment for, you know, there a lot of their services is free. I'm sorry, I shouldn't do that, free. Take the air quotes away, free. So that, you know, if you look, and again, just 211, they'll direct you to those kind of services. And then Bonnie is telling us that several other services in town do online. She's saying CHP psychiatry, a better way. Oh, counseling. So right, there's several that are doing telehealth.
Yeah, I'm so glad you mentioned that. So a majority of our callers will say like, yeah, I'd love to get into counseling, but I don't have insurance. Like so many of them don't even think it's an option. That should never be an obstacle to getting help. There might be a waiting list or it might be lesser options, but you still deserve to get the help you need, insurance or not, money or not. There are resources. You just might have to do some digging and stick with us a little longer. But the mental health navigator is there for that too. Most of her caseload is probably folks in that boat. So always reach out. There's always going to be something. It just might take a little more time investment.
And I would also like to mention, because CAT team, if anyone is worried about uninsured and things like that, as far as like those kinds of outpatient services that the CAT team provides, we do not bill as the CAT team. So the only thing you have to pay for is like your medications and stuff like that. But that we're in this area to provide the service for people that need that intense outpatient care with that wraparound services without you having to worry about paying for anything. And almost everything we do is telemed as well.
Well, thank you, everyone. We have reached the end of our time together, but thank you so much, panelists, for coming. I think someone mentioned NAMI Tallahassee. Also shout out to Beth and NAMI Tallahassee. Just so everyone knows, NAMI is kind of the reason that we were able to have this panel. Beth was integral in us getting the panel together. So, and they also do have a lot of great resources on their website. So I would definitely recommend them. So I know we at the library, we're definitely not mental health professionals, but we do get people that call and they will be having issues like that. We frequently send people over your way, Helena. So, you know, if anything, if somebody's really nervous about calling mental health, I mean, in general, we just get people to call the library and we'll tell them, hey, you should just call 211. Sometimes people reach out to us for research and we look up pretty much anything. Well, we're not mental health professionals. I think I'm talking in circles, but basically we will tell you to go to 211 Big Bend, or we can also like look up those things and give phone numbers and refer people to places like 211. And I just want to thank Laura, Kelli, Mark, and Helena again for being here and answering questions, and thank our attendees for coming.
Thanks for having us.
Same. Yeah, thank you.
Thank you.
Thanks, everyone.
Thank you,
Maybe I'll see you on the
everyone.
phones.
Yep, thank you to
Have a
Stephanie
good
and
night.
Elizabeth for organizing this as well.
Absolutely.
Y'all did an awesome job. Thank you.
Definitely.
Absolutely.
Welcome. Yes.